Hello everyone, I'm Karen Peterson and today I'm here with Dr. Peter Dehnel. Dr. Dehnel is a board-certified pediatrician and he is the medical director of the Twin Cities Medical Society's Physician Advocacy Network. Dr. Dehnel will be sharing with us today what he's learned as a longtime physician leader and public health advocate. Welcome, Dr. Dehnel.
Thank you, Karen. It's a pleasure to be here.
I'd like you to start, if you would, by describing what exactly do we mean by public health, and how is that different from a physician's normal role?
So what we focus on in the normal physician role is a one-on-one interaction with our patients. We focus on their health needs, it's on their potential for health improvement, any treatments that are needed, medications, and so forth. Public health is taking that to a different type of interaction with patients, but it's on a community basis. So we are looking for ways to impact the health of the community, or what we could say is public health or population health.
Okay, now when I've talked with you before, I've heard you use the phrase that public health is thinking beyond your clinic walls for improved clinical outcomes. Could you elaborate on that?
Yeah, thank you. So what as a physician we have an opportunity to do is to not only interact one-on-one with our patients within our clinics, but really there's an important role for physicians outside of the walls of their clinics. So in the community, with community groups, with city councils, with county commissioners, whatever it is, but it's really looking for ways to improve the health of our community, which oftentimes mean we go beyond the walls of our clinics to impact their lives.
Okay, could you give me maybe a specific example? Maybe, for example, I'm thinking about diabetes. How would you do that outside of the clinic walls?
So what we would look for is an opportunity to support a pre-diabetes screening opportunity, working with groups within the community, whether if you have a local chapter of like the American Heart Association or the American Diabetes Association, it's working with groups outside of your clinics to improve whatever health initiative that they're working on as well.
Very interesting. Now, how did you get this bug? How did you get started in public health?
It was something that actually probably before medical school I was involved with a group called Vista Volunteers in Service to America. So I had this notion of how do you impact people beyond your normal scope of activities. And then once I got into practice, I've always been interested to see what things really impact the health of people, whether they be insurance or health education. And so when it became clear that tobacco and secondhand smoke were a big pediatric issue, it was kind of a natural lead into, well, how can I improve the exposure of kids to secondhand smoke, or how can I help stop teenagers from using tobacco in the first place?
Okay, well that gives us a little hint, but I'm curious, what types of things have kept you involved?
Well, I think it's kind of always this notion of how can you really impact the health of people, and it's very rewarding, but in a different way than the reward that you have working one-on-one with patients. You can see little improvements in everyone's lives, but over a much broader number than what you have one-on-one in your clinic.
Interesting. So what do you think makes physicians specifically effective in public health advocacy?
So it's, and just taking a step back for just a moment, sometimes physicians have a notion that they really can't do a lot of activities in this more quote-unquote public health space, but they really do have an important role. And it's where they have an incredible amount of specific medical information, which is important to know. Then you can see, well, okay, so if you have this medical information, what are some improvement steps that people could take to make their lives healthier going forward? And then how, as physicians working together, we can really help to get out this message on a much broader scale than I can within my individual clinic.
Okay, so using that medical big picture knowledge for a specific topic in public health.
Yeah, you do focus on slightly different topics. For example, in terms of, for example, obesity, instead of working on a particular weight reduction program for somebody, you say, well, how can I get the community to be healthier, and how can I help people to be more active in their community?
Okay. So describe for us some of the differences what skills do you draw on when you're in an examination room with one patient versus in a public health role?
Yeah, and this is something that really takes a little bit of education and acknowledgement, and that's where working together in like a county medical society or a component medical society, you do have some advantages of working together because the skill set is slightly different. You're still working with medical facts, you're still working with health improvement, but you need to figure out a way to communicate that in a different way that's effective on a broader scale or on a community scale.
Okay. So what are some of the lessons you've learned being a public health advocate?
Well, I think one of the first things is that you can be successful. And I think for physicians, being able to accomplish something is important. We do like to be, have a good outcome of the work that we do. And I think that helping physicians recognize how they can be successful in this very important space is very important. And then how you can really work to communicate effectively with whatever audience you are working with. So whether it be a city council meeting or a county commissioner meeting, or even just a public education group, you do need to figure out ways to get that message out slightly different than working one-on-one with patients in clinics.
Right. I like that. So now you mentioned that there can be benefits from working within a medical society or a component society. Can you, if you were speaking to another society that was interested in this, what would you tell them as why public health is a good direction to go in?
So I think that if you have a group of physicians willing to work together on a common issue. And that's one of the things that medical societies, county medical societies, need to figure out is which issue they do want to work on. But as an individual physician, you can write a letter to the editor, you can personally attend a city council meeting, but as a group of physicians working together, you can be far more effective than individually. And the other thing, and with all credit to like Twin Cities Medical Society, you need that administrative support to really help you schedule meetings, get people to the right places at the right time. If you're going to provide some refreshments, you need to have somebody order those. You need to have a meeting space. So there's a lot of things that go into the administrative support that county medical societies can do, which is extremely important. And then I think it's really important to help communicate successes within the community back through the county medical society or whatever medical group you're working with. Those are all very important keys to this.
Okay. So one final question. If, as I said a minute ago, if somebody from another medical society or another physician that you happen to meet was interested in doing this, what advice would you offer to them?
I would say be sure to do it. Don't hold back and say, well, you know, I can't do this, or this is outside of my scope of practice, or whatever word you want to use. It's very important for physicians to be involved with this activity. It's important to work with other physicians in ways that you can't as an individual physician, or even as an individual health system. You need to work broadly within the community. And that's where a county medical society has a unique position. They can act as kind of if you will, a Switzerland. They can bring all parties together in a way that other groups do not have that ability to do. And you can focus on local issues, because the issues we have here within a metropolitan area are much different than what they might be in a rural area. So you can work on local issues that are of interest to your physicians, and that you can gain some traction and be successful.
Okay. Well, thank you so much for taking time to sit down and talk with us today about being a physician who is involved in public health advocacy.
Well, thank you very much for this time, Karen.